Hi, my name is Abby and I'm going to be doing my full body assessment on my patient Bananas right here. Hi, my name is Abby. I'm going to be doing a full body assessment today, just making sure that everything is doing what it's supposed to, and I'll just be asking you a few questions. Is that okay? Okay, perfect. Can I just ask you, do you know where you are right now? Okay. Do you know what year it is? Perfect. And then can you tell me what season it is? Okay, awesome. So now I'm going to go ahead and assess your cranial nerves, okay? So for cranial nerve number 1, I'm going to be assessing your smell. So can you tell me what you smell right here? Yep, that's cinnamon. You're right. Good job. Okay, now for cranial nerve number 2, we would have already performed the Snellen and eye chart earlier. We did that when you were walking in, so that's all complete. For cranial nerve 3, 4, and 6, I'm going to have you look forward at me, and I'm just going to have you look. I'm going to shine a bright light in your eyes, okay? Perfect. Okay, now I'm going to look at something super in your eye. It's called the red reflex, so just keep looking at me. Perfect. Perfect. Okay, go ahead and follow this pen, okay? Okay, now I'm going to come behind you and let me know when you can see my hands. Perfect. Yep. Okay, for cranial nerve, for cranial nerve number 5 and 7, I'm going to have you puff out your cheeks. Perfect. I'm going to have you smile, frown. Good. Squeeze your eyes really tight. Squeeze your face really tight. Perfect. Now I'm going to have you close your eyes and tell me when you can feel something, okay? Perfect. Okay. For cranial nerve number 8, I'm going to have you close your eyes and tell me when you can hear something, okay? Perfect. Yep. For cranial nerve 9, 10, and 12, I'm going to have you stick out your tongue. Perfect. Try to touch your tongue to your nose, okay? Now move your tongue from side to side in your mouth, pushing out your cheeks. Good. Now I'm going to have you stick out your tongue. Okay. Say ah. Nice. I'm going to check your gag reflex. Okay. I'm going to have you take a sip of this water, okay? Perfect. For cranial nerve number 11, I'm going to have you shrug your shoulders against my hands. Perfect. Now push your head against my hand. Awesome. Good. Now that we're done with the cranial nerves, I'm going to have you flip your hands back and forth really fast. Okay, perfect. Now I'm going to have you touch each finger to your thumb really fast. Okay? Now stick your hands out and touch your nose with each hand. Okay, perfect. Now I'm going to have you close your eyes, and I'm going to put an object in your hand, and you tell me what it is, okay? Yep, that's a lighter. Good job. Okay, now close your eyes. I'm going to draw something in your other hand, and you tell me what I draw, okay? Yep, you're right. That's a circle. Good job. Okay, now I'm going to have you stand up, and I know for this purpose my patient obviously can't stand up, so I will just be performing what I would tell them to do. So I'm going to have you stand up. Good. Put your arms out to the side and stand up on one foot. Perfect. Now switch. Good. Now I'm going to have you put your feet together, put your arms down, and close your eyes. Okay, perfect. Now I'm going to have you run your heel down your both shins. Nice. Okay, now I'm going to have you walk on your tippy toes. Good. Walk on your heels. Perfect. Now I'm going to have you close your eyes and tell me if something is sharp or dull. When I do this, I'm going to be doing it up his legs all the way up to his arms, okay? Good. Sharp, dull, 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 sharp, sharp, dull. Good job. Now I'm going to go ahead and start assessing your head, okay? So I'm going to palpate the head, looking for any deformities, looking at the thickness and texture of the hair, making sure there's no lice in there. Perfect. I'm going to go ahead and move into the ears. Okay, I'm going to shine this light in your ears, okay? Do you have any pain? No. I'm going to be looking at the tympanic membrane in both ears and just looking at the outer part of the ear, making sure it all looks normal. Good. Okay, now I'm going to go ahead and look up your nose, okay? Perfect. When I'm looking at his nose, I'm just looking for any abnormal drainage. I'm looking for any, like, the septal defects in the nose. Looking at the mucous membrane. I'm going to go ahead and shine a light in your mouth, okay? Perfect. Looking at the mucosa, making sure it's an appropriate color. Okay, now I'm going to go ahead and assess your neck. I'm going to feel the neck for the lymph nodes all the way down. Good. Having any pain? Perfect. Now I'm going to go ahead and feel your thyroid. Okay, can you drink some water? Perfect. Now I'm going to go ahead and have you turn your head to your right, okay? I'm going to feel the jugular vein. Good. Now I'm going to go ahead and listen to your carotid artery with the bell of my stethoscope. Can you turn your head? Perfect. Good. Now I'm going to palpate his carotid and his radial pulse at the same time. Good. Perfect. Now I'm going to go ahead and listen to your heart. So that I'm going to switch it back. The first thing I'm going to listen to the aortic valve, the pulmonic on his left side, Earth's point, tricuspid valve, and mitral valve. Okay, they all sound okay. Now I'm going to go ahead and flip to the back, and I'm going to listen with my bell. I'm going to listen to your lung sounds. Or not my bell yet. I'm just going to listen to his back lung sounds first. Perfect. Now I'm going to switch to my bell, and can you say E? Perfect. Keep saying E. Okay. Now can you whisper 1, 2, 3? Good. Now I'm going to tap the back and tell me if it, or I'm going to have you put my hands on your back and say say ABC, okay? ABC, good. ABC, perfect. Now I'm going to percuss the back part of your back. Tell me if you have any pain. No? Okay, perfect. Now I'm going to go ahead and have you squeeze my fingers. Okay, push up on my hands, down on my hands. Okay, push up on my hands with your feet, down with your feet. Okay. And I'm going to go ahead and ask you to lay down. Okay. Can you push, or when I push up on your feet, I'm just looking for Holman sign right here. Having any pain? Nope. Good. Okay, now I'm going to look for clonus. Put your feet up and see if it falls down like this. Nope. Nope. Okay, perfect. I'm going to go ahead and listen to your front lung sounds, okay? Okay, I'm going to listen to your abdomen. I'm going to listen to the aortic. Okay. I'm going to visibly look in the abdomen and make sure that there's no visible abnormalities. Are you having any pain in your stomach? Okay. I'm just going to lightly palpate your abdomen. Tell me if you're having any pain. Okay. Now I'm going to deeply palpate it. Having any pain? Perfect. Now I'm going to percuss it. Any pain? I'm going to deeply percuss on the side of his liver on his right side. Any pain? Perfect. Okay, now I'm going to deeply percuss his spleen. Any pain? Okay, perfect. Now I'm going to ask him to sit up once again. Okay, and I'm going to check his reflexes. So the first thing I'm going to check is I'm going to have him bend his arm and kind of dangle his hand and kind of shake it and see if his hand does dangle. Okay, now I'm going to hit the elbow and see if he moves his arm. Perfect. I'll use this as my reflex checker. Okay, now I'm going to flip his arm like this, put my hand right on his intercubital spot, and see if his arm flips up. Good. I'm going to go on this side. Perfect. Now I'm going to check his radial reflex by hitting him right about here and see if he flinches his wrist up at all. Good. Perfect. Now I'm going to go ahead and check your reflex with your knee. So go ahead and dangle your knee off the edge of the table. Okay. Good job. Okay. So all of his reflexes were intact. I'm going to go ahead and I already checked the carotid pulse and the radial pulse. So I'm going to go ahead and check his popliteal pulse. Good. His pedal pulse. Okay, and there's one more reflex I did forget, is his Achilles reflex. So I'm going to hit his Achilles and see if his leg goes down at all. His foot, I mean. Perfect. Okay, now I'm going to make sure to check cap refill. Good on his hand and his feet. I'm going to make sure to check for edema. And I think that's about it. And I'm finished with my head to toe.